Thank you so much for joining us. We are super excited as we are acknowledging Endometriosis Awareness Month during the month of March to be able to take this time to provide education for our community, both near and far, so that way people can be better informed as to how to advocate for themselves and also take care of themselves as they are battling endometriosis, and also as they're helping those loved ones of theirs battle this disease as well. I am so very excited to be able to present tonight with Dr. Williams. Dr. Williams is a primary care physician, so we are going to go ahead and dive into everything a little bit. But before we do, I at least do want to take a time to make sure that everyone knows if they have any questions, that they can reach us after this as well. We will make sure that we have our contact information available for you, so that way you can easily reach us and contact us. All righty. And just want to make sure. Perfect. All right. So endometriosis, how can you take control of your symptoms? So this is what the presentation is going to be on. So that way you will better know how to navigate these symptoms, what you can do on a daily basis to make different modifications and also additional resources that may be available for you. So our presenters, my name is Dr. Dionne Middlebrooks. I am a physical therapist. That is enough about me because I really want to take the time to highlight Dr. Williams because she has so graciously donated her time to be here with us tonight. So thank you so much, Dr. Williams, for joining us. So she is the owner of Gateway Direct Health. This is a concierge-based practice. And you may be surprised to find out that, yes, I have someone on here who's a primary care physician who's going to be speaking with us about endometriosis. So why do I bring that up? Because it is extremely important that we recognize that a lot of times the primary care physicians, they're the ones that we're seeing first when our symptoms initially start. So unfortunately, because of the healthcare system that we live in, a lot of primary care physicians have gotten a bad rap of not spending enough time with patients. Thankfully, Dr. Williams has a unique practice model because she is a concierge-based physician where she's able to spend time with her patients. So that way, if you're experiencing these symptoms, she can help you identify what next course of action needs to take place. So yes, I know a lot of people ultimately see between 7 to 8 providers before they truly get diagnosed with endometriosis, but the symptoms start years before the diagnosis does. So make sure that when you are seeing someone, that you find someone like Dr. Williams, who's able to sit down and spend that time with you and get a thorough history, because getting a thorough history is key to making this diagnosis. Dr. Williams, would you like to take a moment to just further introduce yourself and give us a little bit of background about what you do?
Sure. Thank you so much for the introduction, Dr. Middlebrooks. So again, like she said, I am a board certified family medicine physician, and my practice is Gateway Direct Health, and it's a concierge practice, meaning, like Dr. Middlebrooks said, I am spending more time with my patients, and I am their personal physician. A lot of times in the traditional healthcare space, patients, like you said, are having to be pushed to different doctors. They have to tell their story over and over again. They don't have a consistent doctor and spend only 5-10 minutes with them. With this model, this allows patients to get their concerns addressed so that they know that they are heard, seen, understood, and valued. And so that we can get to the root of issues instead of, all right, here's the pill here that is just going to mask or decrease your symptoms, but not really get to the root cause. And so our practice, Gateway Direct Health, is definitely based on lifestyle, right? Lifestyle medicine, because I know there are so many things that we can do before we start prescribing pills, but we need the time to educate our patients. I did my training at Emory, like Dr. Middlebrooks as well. We both went to Emory at separate times, and was able to get the training, adequate training to be a primary care doctor, and then again, focus on lifestyle medicine.
Perfect. Thank you so much for that introduction. And another point that I also want to highlight, excuse me, is that you probably already know this, but she's a female physician. Ladies, that is important when you're seeing a physician because sometimes they can better relate to your symptoms and they also can let you know what is normal and what is abnormal. So we're going to continue into the presentation, but like I said, you'll have our contact information. That way, if you have any questions, any concerns, we'll be able to better assist and or direct some of those for you as well. So it is extremely important that you all know that even though you're participating in this webinar, that we are not giving you personalized medical advice, okay? So yes, we are medical providers, but we are not your medical providers. So it is important that with the information that we provide you with, that you utilize it to better educate and advocate for yourself. So take this information to either help yourself find a better medical provider, because sometimes that is the answer, or other times to have a better candid conversation with your current medical team. So like I said, this is not medical advice that we're asking you to implement immediately, but more so giving you ideas as far as that way you can have conversations to improve long term. All right, so what is endometriosis? It is estimated that about 10% of women suffer from endometriosis, but I actually think that number is a little lower. The reason being is because a lot of women start experiencing certain symptoms, which we'll go over, well before this is diagnosed. And these are only the confirmed cases. So endometriosis itself is an inflammatory condition that impacts women. It involves a tissue that is similar to, but also very different to the endometrial tissue that is within the uterus. It is important that I make that distinction because for years, people have wrongly accused the uterus or the endometrium itself for being the cause of endometriosis, okay? So it's important that we make that distinction. So this is a disease that does respond to hormones, which is why you do see a lot of providers providing hormonal-based treatment in order to help manage the symptoms. Specifically, it's been shown that women with endometriosis have higher levels of estrogen, and that's going to be key as well when we start talking about some of the lifestyle management techniques as well. Dr. Williams, is there anything else that you would like to add as to what endometriosis is that can give a better explanation for our people?
Sure, yeah. So the endometrium, like Dr. Middlebrooks said, is the lining of our uterus, right? That's what sheds during our menstrual cycle, right? And it's supposed to be within the within the uterus. But endometriosis is when that tissue is outside of where it's supposed to be. We're very reactive to estrogen starts causing symptoms like we'll talk about.
Perfect. Awesome. And so with this itself, it is also important that we make note that this can occur in different regions throughout the abdominal and pelvic region. So there are typically 3 different types. They also have now included adenomyosis as the 4th type with that. But when we're speaking just in regards to the endometrial-like tissue, still once again, very different from the actual endometrium itself, that can adhere with the throughout the abdominal and the pelvic region, causing unfortunate pain and some other things. So what symptoms do we typically see? And I want you to think about your childhood, especially when you began menstruating, or even friends who began menstruating. Because if any of these signs and symptoms have impacted you, this is something you want to consider. Now, am I saying that you have endometriosis? By no means, no, because there are several things that can cause this, but this should at least get the conversation started for you. So what are we talking about? Irregular menstruation. On average, people should have a menstrual cycle between 25 to 28 days. Some women will go a little less than that. Other women will go a little bit longer. But if you notice that you're going longer than about 28 to 35 days, at that point, you want to speak with your medical provider. Because if you're not speaking with your medical provider and that is occurring, you are missing out on a vital sign for the woman body, for the female body. Yes, our menstrual cycles itself, they tell us a lot about our health. It tells us a lot about our metabolism. It also tells us a lot about our muscle and our bone health as well long term. So you want to make sure that you're tracking your menstruation. If your provider's not asking that information, you need to offer it up. So painful periods. Now, what defines painful periods? This is going to be subjective to the person. But if you're having periods that are taking you out of work or taking you out of school, that can be an indication that something is drastically wrong. It is one thing to have some light cramping. It's another thing for you to be in tears and boiled over because you're in significant pain. Those are 2 different aspects. And we want to make sure that if you're having those symptoms, that you're making that known to your provider. Also, pain with intercourse. This is something that a lot of women with endometriosis suffer from simply because of the adhesions that occur. And with penetration itself, they tend to complain more so of depth of penetration where they're having that pain. Bladder symptoms and bowel symptoms. Bringing this up because endometriosis can also have an evil twin or evil triplet. Interstitial cystitis and also IBS, because of the presence of the endometriosis and also the adhesions that are there, that can impact how your bladder itself is functioning and also how your digestive tract is working. So it is not uncommon for women with endometriosis to have one of these additional diagnoses as well. So back pain or hip pain simply because of the location of the tissue and also the adhesions. And now, if you've experienced these symptoms, especially over a long time, you notice that a lot of times people have mood changes. This is not uncommon for any chronic-based condition and also chronic pain, because this impacts the way your body perceives and also the way your body senses, meaning your nervous system becomes involved. So if you've had depression or anxiety, that can be a cause. This can be a common symptom associated with it as well. Bloating and fatigue, bloating more so going along with the digestive systems, and fatigue, because let's be honest, your body, your metabolism has already had to adjust to trying to maintain this level in the midst of pain. And then also the chronic fatigue that is associated with being in pain as well. So these are symptoms that we want to make sure that you're speaking with your medical team about, because if you're having any of these, there are different things we need to take into account to address it. And there's one up here that just came to my mind that, forgive me for not putting it up here, but heavy bleeding. Dr. Williams, this is, I'm not sure about you, but I see a lot of women who have heavy bleeding with endometriosis and also with fibroids. And for some odd reason, maybe you can give us some insight on this. It's not, a lot of them don't realize that they may be anemic or even at risk for anemia. Do you mind speaking on that a bit for us?
Sure. I think it's interesting now that I have the concierge practice and spending time with patients. I'm realizing that what I think that everyone knows, they don't know, right? I think that's the part of the problem with rush visits is that you're just like making assumptions that everyone understands what you're saying. But yes, like prolonged periods are associated with anemia, and anemia is when you have low hemoglobin, your blood count is low because you're bleeding excessively, and your body is not making enough to adjust for that, for how much you're losing, and so that can play into the chronic fatigue, into dizziness, into feeling like you're dehydrated, lightheaded, and even passing out, unfortunately. But it and then a lot of women don't know, okay, what does that mean? Prolonged periods or heavy periods. If you're using a pad every hour, you have to change it every hour. That is heavy bleeding, and that's significant. But again, in our typically we don't talk about our menstrual cycles, right? Parents don't talk, our grandparents don't talk about menstrual cycles, and so probably a lot of people assume whatever they have is normal. Like you said, they're having vomiting and curled up in a ball and have to miss work, a few days out the month, and just think that this is normal, but it's not, and that's why it's really important, like you said, to offer up that information and to let your doctor know, hey, this is what my periods look like.
That's awesome. Thank you so much for that. And I know a lot of women, especially with us saying anemia. So no, we're not telling you immediately to go get on iron pills, but we're telling you to speak with your provider so that way they can do blood work and determine not just your iron levels, but also your ferritin levels as well. So that iron stores, because that can be just as important, especially leading up to your cycle as well.
Right.
And also just a nice little caveat to add in, your provider should also make sure you're getting enough vitamin C if you are anemic as well, because your body's going to need the vitamin C in order to absorb that iron. Okay.
That's
So
right.
thank you so much, Dr. Williams.
That's right.
All right. So common myths. And I would love for us to kind of have a dialogue about some of these common myths because I've seen and heard these stories. So people are commonly told, well, thankfully this is changing. I will say that it is changing, but they have been historically told that pregnancy can cure endometriosis. Same thing with hysterectomy, and that they also have been told that it is the exact same thing as far as like the tissue that lines the uterus, that that's the exact same tissue type that is growing outside of the uterus. And they've also been told that birth control can fix endometriosis and the symptoms. So, Dr. Williams, do you mind speaking a little bit as to how these things can impact, one, how these things impact the care that we give, but
Right.
also a little bit of how some of these theories came about?
Sure. Yeah. I mean, to be honest, endometriosis is a very puzzling, disease, right? Like, why would tissue from one place be outside and go somewhere else, right? Like, not to scare anyone, but like cancer, right? It's in one tissue and then metastasize, go somewhere else. And so it's puzzling with endometriosis. It's not cancer at all, by no means, but it's just a tissue that's found somewhere else. And so I think, and then the fact that we know that it is sensitive to estrogen, and so the assumption would be, okay, yeah, just birth control to lower that estrogen, so you don't have the estrogen spike. Estrogen level is, or it's leveled, so it should be fine. Or pregnancy, okay, you don't have all that estrogen spikes, it should be level. But unfortunately, we have found that not to be true. But again, with the information that we had at the time, that's probably why those myths were perpetuated. But pregnancy, unfortunately, is not a cure for endometriosis. Birth control is not a cure for endometriosis. The hysterectomy is not a cure for endometriosis. It would be nice, right, if those things were cures, but unfortunately, we don't have any at this time. However, um, I know the big reason why hysterectomy seems like a logical choice is because, oh, you're taking out the uterus. But again, are those cells outside of the uterus, right, causing issues. And so even if you were to take out the uterus, does not mean that your symptoms will be gone, because again, that tissue is outside of the uterus. So, and then birth control, again, trying to level out those hormone or trying to level those hormones. However, there are, for patients with mild endometriosis, it can definitely help with the symptoms, but again, it's not a cure and it does not reverse the disease. But then for some patients with severe endometriosis, some other measures need to be done. And then, like we were talking offline about endometriosis, right? But typically how you diagnose it is or the gold standard, meaning like this is the way to diagnose. You would do a surgery, right? A diagnostic laparoscopic procedure. I don't know why I'm not getting my words right, but basically you're going into the abdomen. You don't know what you'll find, but if you see something abnormal like endometriosis, you will take a sample of it and look under the microscope. And what we thought was, okay, this is endometrial tissue within the uterus, aligning the uterus that got outside of the where it's supposed to be. But like we were discussing, they're finding that it's endometrial-like or similar, but not necessarily exactly the same.
Mhm. Awesome. No, thank you for that. And one big thing I do want to emphasize with this is that currently, like she said, we do not have a cure for this, but there are ways to manage it. And we're going to talk about some of the holistic, natural ways to manage it. But yes, can medications help? Yes, they can. So I don't want you all to go into this presentation thinking I need to stop all my medications. No, please make sure you're speaking with your medical provider, because there are several medications that can be used to treat pain and depression and also other nerve-based symptoms as well, that you do not want to just stop abruptly. Okay. So I want to make sure that you all understand that, but also that you all do realize that with endometriosis, yes, surgical intervention can be beneficial. And if you are going to pursue surgical intervention, there's a difference between the types of surgeries, and you want to make sure that your provider is going to be providing an excision versus an ablation. Yes, at times they can combine the two, but the more tissue that they can excise out of the cavity, out of that region itself, the better your symptoms will be long term. And then also the more adhesions that they can remove as well, the better your symptoms will be long-term as well. But this is, like she said, this is a very complicated disease process. And so it is something that we are learning more and more about every single day, but we do not have a definitive cause. We do not have a true cure, but we at least want to make sure that you're equipped with the knowledge that you need to have a better quality of life.
And better conversations with the doctor, right?
Yes.
Yeah.
Yes. Perfect. So with this, how can you take control of endometriosis? So lifestyle modifications are effective in helping to decrease the symptom occurrence and improving quality of life, as we just mentioned. So once again, this is not going to be a cure, but this is going to help you manage. So we want to make sure that you're able to manage things, and also that you're able to have these better conversations to advocate for yourself and for your loved one. So first, let's talk about inflammation. Inflammation is, once again, complicated. Everything with endometriosis is complicated, but everything that we do nowadays, our society pushes us more so into an upregulated sympathetic system, which worsens our inflammation. Our inflammation itself is impacted by how we sleep, what we're eating, our weight, environment we're exposed to, and then inflammation in itself is not always abnormal. As we age, yes, we can have different changes as far as how our body responds, and we may notice that at certain times we are a bit more inflamed, if you want to put it that way. But if you can look at this list and you're looking at diet, sleep, environmental exposure, and obesity, aging, you have 4 things on there that you can change and you can modify. I'm hoping you continue to age, because that's a blessing. That's a wonderful thing. But everything else you're doing on this list, those are things that you can modify. So we're going to talk a little bit about how addressing these topics can help improve your symptoms. Why are we talking about inflammation? Because endometriosis is a chronic inflammatory disease process. So we want to make sure that we're at least trying to minimize and help mitigate the inflammation that your body is exposed to. So first, diet and nutrition. Yes, some people believe there's certain foods that should be avoided, and that is true. That is definitely true. This can differ from person to person. So before we start talking a little bit about have a dialogue about diet and nutrition, I do want to emphasize that I personally like referring all of my endometriosis individuals, all my individuals with endometriosis, to a dietitian. someone who is familiar with helping this disease process so that we can decrease inflammation, but also I can ensure they're still getting the nutrients that their body needs. Because if you're trying to attempt diet modifications on your own, a lot can go right, but a lot can also go wrong. Okay. So please make sure that you're just taking this information as far as education, so that way you can present it to your provider and also get paired up with a dietitian who can help you navigate this better. So, Dr. Williams, what type of food types and selections that people typically avoid if they're trying to better control inflammation?
I know everyone loves their meat. I get it. I get it. I get it. Shoot, I eat it. However, we know that red meat is associated with too much, right? Like too many side effects as far as obesity, high cholesterol, hypertension, or high blood pressure, and even cancers, right? Like red meat is associated with certain cancers. And so, and I believe it's because they are probably pro-inflammatory, right? They increase our inflammation. So yes, red meat should be avoided. I'm not saying you can't have it ever, but definitely decreasing how much we consume.
Perfect. And in addition to red meat, another one that tends to be up there as well is pork. Pork tends to be inflammatory for a lot of people. And there are some people, when it comes to diet, they do benefit from the FODMAP diet, but that is also associated with IBS. So if you're noticing that you fit, there are a lot of things on that FODMAP diet that you cannot eat because you fit more so into that category, then yes, maybe we need to be speaking, like I said, with the dietitian, but also trying to see exactly what is going on with your digestive tract, with your colon, so that we can get a better idea as to how you're absorbing those nutrients as well. Other things that can be inflammatory with the body, let's think about all the processed food that we're exposed to and everything that we're eating. So you should be going for a diet that is whole foods. What do I mean? The ingredients that you're eating, one, you should be able to pronounce them. If you can't pronounce them, it's probably a science experiment. And then two, you should be able, it should have a minimum amount of ingredients and you should be able to read them easily. So if you're eating something and it has 30 ingredients and only two of those are actual food products, that is a processed food. For refined sugars, something else you want to avoid as well. And then one big thing I tell people when it comes to diet, especially after speaking with different dietitians, the more colorful your plate, the better, because at that point, you know that you are having a more balanced diet. So yes, the more colorful your plate when it comes to fruits and vegetables, the better. There's also some research that does support fiber for managing estrogen levels. And guess where you can get your fiber from? Fruits and vegetables. Yes, you can get it for whole grains as well. Fruits and vegetables tend to be what most Americans lack, so which is why I'm emphasizing that. And especially in America, we don't tend to get enough fiber in our diet. So if you're having some of these symptoms, make sure that you're looking at your diet and making those modifications. So, like I said, with the FODMAP diet and endometriosis, there are some people who do benefit from that, and that diet does involve eliminating certain carbohydrates. One carbohydrate that I want to focus on is more so related to like the flours and breads, because there are a good number of individuals, even though they may not have celiacs, where they still do have a gluten sensitivity, and their body will still respond in a way where they're having bloating or increased pain or symptoms. So yes, for some people, they may want to minimize the amount of gluten that they are exposed to. Did you want to add anything at all to that, Dr. Williams?
Oh no, that was great. Like you said, refined, simple sugars for sure. We've seen increased inflammation, increased fat, increase your risk of diabetes and other chronic conditions. So definitely decreasing how much, and not just avoid putting sugar in my tea, but like your soda, right? Your
Yes.
juices, your sweet teas. Because I know my patients will be like, no soda, doc, never. And then once I mention sweet tea, all right, doc, you're doing too much.
Sweet tea and lemonade.
Exactly. So it's not always in like cupcakes and donuts, but also think about the amount of sugar we're actually drinking.
Yes, perfect. And right now as well, there's some information indicating that dairy products may not respond, some people may not respond well to dairy. So there are certain genes that do link individuals that may be a bit more dairy intolerant. If that is the case, then yes, dairy may be something that you want to eliminate. And they do have additional options for that nowadays, which is wonderful. So that way you can still make sure that you're getting your calcium, because a lot of people are consuming milk for the calcium itself, but there are other options that you can get it from, including your food. Um, one thing that I have noticed different dietitians and also some research on is the addition of omega-3 fish oils to the diets itself, because this has been shown to help decrease inflammation. And if you're able to incorporate this safely and also making sure it does not interfere with any other medications at all, so speak with your medical team. If you're able to incorporate this, this can have health benefits, not just for endometriosis, but also long-term as well. So one big thing, when individuals have endometriosis, they're at risk for other comorbidities. So making sure that you're getting the appropriate fish oil, omega-3s, can definitely help to mitigate some of that as well. All right, so sleeping. Oh, this is a favorite topic of mine because I'm pretty sure I talk to all of my patients about diet, sleeping. Oh my goodness, because people don't sleep. People do not sleep. So we should be getting between 7 to 9 hours of sleep per night. And I would ask you all to raise your hand if you're actually doing that, but let's be honest, most of us aren't, and I've been guilty of that as well. But we really should be getting this amount of sleep because our body needs it in order, one, to maintain the proper hormonal function, but also to allow for our body to kind of reset. So when you're sleeping, that is when your body is able to reset and restore. So that is when a lot of rehab, if you want to put it that way, takes place naturally. Also, if you were sleeping the appropriate amount of time, ladies, you already know we have a harder time when it comes to weight management compared to men. And some of it is just how we're made. It's our hormonal levels. So if you are noticing that as you are, that you're not getting enough sleep, and you're also noticing that you're having a hard time losing weight, and that your pain levels are higher, and that you may have depression or anxiety, I would kind of consider, hey, maybe my cortisol levels are elevated. And that all can kind of go back to, do we have adequate sleep? So what can you do to make sure you get enough sleep? And you probably don't want to hear this, but the same way we do with children, set a bedtime routine. Make sure you have that routine in place so that way your body can start beginning to actually shut down. A lot of us take this lovely thing right here with us, we take it to the bed, and next thing you know, we're scrolling. So you want to make sure that you're not doing that, because that can impact your sleep. That can cause your brain to stay in a more aroused state. And at that point, you're going to have a hard time falling asleep. So Dr. Williams, I would love to hear your thoughts on sleep, because I know, like I said, all my patients, I end up having to educate on the importance of sleep when it comes to managing hormones, when it comes to managing pain and managing inflammation.
Listen, when you talked about the kids, like the same way we know how our kids act in the morning when they don't get adequate sleep, and we're pushing that as a priority for a bedtime routine. We tell them, all right, let's calm down, let's take a bath, let's read, and then go to bed. It's the same way that we should be taking care. I call it self-care, right? That also should be our self-care routine. Not having FOMO, fear of missing out. And that's why we're scrolling on our phones or on the TV. Like, we are just as important as our kids, right? And we should also be examples to them of how to take care of ourselves. Because again, like you said, when we don't have that rehab, restful sleep, where we're going into the deeper levels of the sleep, we're not getting adequate rest, and therefore are running on fumes the next day. Our cup is half full, and then we just keep pouring our cup out without allowing time to fill up. And like you said, it's so helpful for weight management, for anxiety, depression, diabetes, hypertension. Again, like I talked about, lifestyle being the first prescription that we should give patients. Sleep is included, like, dramatically. And when you're tired, go to bed. You don't have to stay
Yes.
up. It's okay. Go to bed. Lord said, worry about tomorrow, like, right? Like, go to bed.
And because we've talked about nutrition now, because we've talked about sleep, I think it's important that I kind of build this link here for you. So if your gut health is already messed up, meaning that you don't have the proper nutrition, you're not going to be able to sleep. And your sleep is going to be terrible. The reason being is because majority of the serotonin is made where? In your gut. What does your body need serotonin for? Of course, to help with our mood, but also to make melatonin. So before you just start popping more melatonin pills, take a look at your diet, take a look at your sleep habits. So that way you are better able to address this in a more natural, holistic manner versus always having to run to something. And a lot of times we need to change what we are doing. So yes, you're going to have to make changes, which is going to be important for you long term. So like I said, I spend a lot of time talking about diet, nutrition, and sleep. So I am extremely passionate about everyone getting enough sleep, myself included. I will do better, y'all, I promise. But waking up during the night, why are you waking up? That's the first question I have. Some people tell me, oh, I'm waking up because I need to relieve my bladder. Okay, well, if you have to relieve your bladder, now I'm asking additional questions as to what is going on that you're having to relieve your bladder. What are you drinking before you go to bed? Or are
Right.
there other symptoms going on? Maybe you need to see me for pelvic floor physical therapy because there's something else going on. Or are you waking up around 3 or 4 o'clock in the morning consistently just to wake up? Because even at during this 3 or 4 o'clock range, there's some theories out there that indicate that our minds are just over aroused, and that is more so of a stress response. So let's evaluate why you're waking up. Do you really have to go to the bathroom? Sometimes you do.
Right.
Other times it's more so your body's stuck in that stress response. And there's this really good book called Why Zebras Don't Get Ulcers. So with that book itself, they describe that, if a lion's chasing you, so ladies, imagine that the lion's all those deadlines, you got the kids screaming at you, got to figure out dinner. That is your lion, just everyday life. If that's chasing you and all of a sudden you're trying to get away, so yes, you're moving, you're running as fast as you can. So what happens to the zebra compared to what happens to us? The zebra, after it gets away from the lion, literally is able to shake and reset its nervous system. Guess what we don't do, ladies? We don't reset. Dr. Williams already mentioned the importance of self-care and how the bedtime routine can be a part of that. This is your chance to reset. This is your chance to restore the body. So be intentional with the sleep that you're getting. Be intentional with the self-care and the rest that you're getting. And I have to say this because too many ladies think self-care is always getting your nails done, your hair done. Self-care is making sure your body can maintain for the long haul. And yes, your hair may look good. Yes, your nails may look good. How is that going to impact your overall wellness and health in the long haul? So I want y'all to think about that. All right, environmental exposures. So we have to talk about BPAs. Like we just can't get around it, because if we don't talk about BPAs with environmental exposures and also the impact that it can have with estrogen, this is important because we're exposed to so many different toxins every day, and some of it you can't eliminate. It's just the world that we live in. But there's certain things that you can eliminate. So, Dr. Williams, I would love to hear your thoughts on BPAs and relationship with estrogen, because we know there's a lot of research coming out indicating that there is a link with how our bodies actually utilize hormones and produce hormones with exposure to BPAs.
Listen, like you said, you know, I think we've made like so much progress as humans, right? As a human race, we're doing all the things. We had so many different kind of industrial revolution, technology age, all the things. But what we're noticing is that we are using more of those tools to help us in life. However, those tools may be toxic to us, unfortunately. And it's sometimes hard to be able to pinpoint, okay, what's this common thing that is increasing our risk of endometriosis or fibroids, right? There are a lot of different theories on why Black women have more are at higher risk of fibroids compared to those of other race. And so, yeah, unfortunately, and links to different toxins like BPA.
Awesome. So read the products that you're buying.
Right.
Simple as that. Read the products. That way you will have an idea as to what you're being exposed to. Because sometimes they can be, of course, they can be in your food. It may be in your skincare routine. So make sure you know what you're putting on and in your body. And like I said, there's certain things that we just cannot control because we're exposed to pollution every day. If you have a car, you're exposed to pollution. Even if you don't have a car, the world that we live in, you're exposed to it at all times. So making sure that if you know that you're more sensitive and you're noticing, hey, at this time of day, especially we're located in a metro Atlanta area, certain times of day, pollution is worse. So is that probably the best time of day for you to go outside and do your walk? It may not be. So make sure that you're taking those things into consideration as you are trying to navigate this. But like I said, we have to talk about BPAs because BPAs, they do impact estrogen. Studies have actually shown that it can cause an increase in the estrogen that your body's producing because it can mimic it as well. So make sure, as it may mimic the estrogen, your body at that point is saying, well, I'm making it, and now we have extra, and that can further complicate things. And like we said in the beginning, endometriosis directly responds to estrogen. It is dependent upon it. So are we trying to cure you with removing BPAs? Like I said, no, we cannot offer a cure, but at least minimizing exposure can potentially help decrease the inflammation that your body's experiencing. Weight management. So we already talked a little bit about nutrition. We talked of the importance about weight management when it comes to sleep, but overall weight management. And Dr. Williams, I would love to hear your thoughts because everyone, whenever they hear weight management, people immediately run to BMI. And BMI, I know in the US, still as a whole, is still the preferred method of trying to see how people's weights are managed itself, or how they're looking at that point in time. But we also know for some people it can be spot on, others it can be completely off. But spoiler alert, I hate to say it, but as a general population for the Americans, for us Americans, because our diets are terrible, BMI still is pretty accurate across the board. So I hate to say that it is discouraging, but I at least want to make sure that we address BMI, Dr. Williams, and also what healthy weight looks like, because healthy weight is going to look very different from person to person.
Right, I appreciate that. So BMI, we're looking just at two things: your weight, your height. That's it. Through BMI, I cannot tell you anything about fat composition. I can't tell you anything about muscle composition or water composition. That's We only got two measurements, right? Weight and height. And so some patients may say like may be labeled as having a higher BMI or overweight or obese. However, they're just tall, right? Or yeah, so those are like reasons of one example of why BMI could be off. But like you said, however, a lot of us have a lot of truncal fat, a lot of fat in our abdomen, which we know is associated with insulin resistance. We know it's associated with diabetes. We know it's associated with inflammation for sure. And so our poor American diet, our poor American culture, and not getting enough sleep, always having to run, always have to strive. Like going back to your story about the zebra and the lion, like we feel like something's still chasing us, right? Our anxieties or worries are still, the bills are still chasing us, and so we can't turn that off. Therefore, impacting our sleep, therefore impacting our function and our mental health, all the things. And then, of course, endometriosis, like we're talking about today. But I like talking about this because when we see patients who have lost the weight and have entered a healthy lifestyle, the transformation is absolutely mind blowing. Like they're saying that they have better quality of sleep, they have more energy, they can play with their kids, they're not having as much back pain. All the medications that, listen, I have patients like all the medicines that they were on for pain, they're not on it anymore. Patients don't need the CPAP machine anymore. They don't have sleep apnea anymore. Like, I don't think we realize how much weight impacts our daily life until we have that transformation and are amazed by it. So, and the same goes for, I'm sorry, back to endometriosis. The same goes for endometriosis. It can help with the symptoms. Again, not a cure, but you're at a better, healthier state. So like if you did need surgery, right, your risk of complications from the surgery is lower than someone who is still struggling or still obese, right? So it's not just always about the direct correlation in decreasing pain and symptoms. However, if there are other issues, it's always better to be well at baseline because your recovery and your jump back, or what the term is, but yeah, your recovery is always better.
Awesome. And you mentioned one thing as well with the body composition. And body composition is very important to consider because it is possible people automatically assume because someone is more slim that that they're at a healthy weight, and their weight may be fine, but the body composition is what we're concerned about. That may be problematic. So yes, I know that I think that the term the street term is you can be skinny fat. It's possible. Yes, it really is possible. And Dr. Williams points to herself. I hope not. No, ma'am.
No, pointing to me. I need some help.
So yeah, so with that, it is definitely possible. And body composition, like I said, is something you want to address and be aware of, especially when it comes to that fat, the adipose tissue. Why fat and adipose tissue? That tissue itself is known for producing additional estrogen. And what did we already say about endometriosis? It responds to estrogen. So why not go ahead and just decrease adipose tissue itself, get your body down to a healthier weight. So now you can minimize the risk of inflammation. Because like I said, the goal of this is to try to minimize your risk and also to help manage. These are things that you should know as you're navigating endometriosis throughout the entire span. So not just before surgery, not just during, but after and also ongoing. So make sure that you are taking the time to address this issue because, like I said, adipose tissue is known for producing estrogen. Yes, your ovaries can as well, but so can fat tissue. Make sure you take care of that. You talk to someone, work with a dietitian, work with someone who specializes in weight management. I know Dr. Williams does as well. So that way you can have the appropriate care and take care of your body long term. All righty. So one question I always get from my patients is, well, how long does it take for these changes to be effective? And I'm going to tell you a 4-letter word that no one wants to hear: time. Time, y'all. Okay. It takes time because your body has been undergoing the actual disease process now for 5 years, 10 years, 20, however long you've been battling it. So this is not something that happens overnight. This is not a magical pill. I wish it was, but it's not. But it's better than a magical pill because now you know how to manage your symptoms. You know that you're able to begin to start to kind of journal and watch and see, hey, when I ate this, my body didn't respond so well, kind of took me out. I had a flare after I did this. When I was going here and I was exposed to this, I started noticing that I had a flare, or you know what? I even noticed my symptoms were much better. So that way you can start realizing that, hey, there are some different things that you can do to control your symptoms. So how long does it take? You should try all of these things. When I say minimum, for a minimum of 8 weeks, minimum. And at times, some people are going to have to go longer than that. Usually within the 8-week period, people are able to notice different changes. And I know that we've presented a lot of different things to modify. So I get it. It can be overwhelming. If you can't modify everything, pick one thing. And like I tell my own patients, if you have to pick one thing and it's not going to be your diet, can I get you walking? Can I at least get you walking? Let's start there. And if you're able to successfully walk, great. Now you're ready to talk to a dietitian. So that way we can make sure you're on a nutrition plan that is appropriate for you. So pick one thing at a time. So that way you don't become discouraged. Because I don't know about you, but I know me. If I set a goal, I want to go hard at the goal and I want to get everything done immediately. And the next thing I know, I'm overwhelmed, I'm discouraged, and I'm tired. And if I'm able to press through to the end, is it really the best? But most of the time, especially depending on the goal, can I even press through or do I just give up? So make sure that you're giving it time. Dr. Williams, I would love to hear your thoughts on pretty much the whole time concept because especially we live in a microwave society. We want things done immediately.
Listen, even the pills take time, right? Even the injections take time. So I agree with you. I think that lifestyle changes as as life changing as they are because they take time. It's very it can be discouraging for patients or just humans in general to adhere to them and stick with them. So as long as we have reasonable expectations, like
Yes.
I think that's what's important. Same thing for medications, having reasonable expectation. I thought I was going to bring my blood pressure down after taking one pill. Okay, that's not how it works, right? Reasonable expectations. So even with the lifestyle changes, after making a determination to say I'm going to get better sleep, best believe there's going to be something that's going to trying to disrupt your sleep, right? As soon as you're like, I'm going to go to the gym every day, or let's say 3 times a week for whatever, and then I'm going to increase. Best believe something's going to try to disrupt you, and that's just unfortunately the nature of life. That there's always distractions and disruptions when we're trying to do the right thing. So, like you said, in order to decrease being overwhelmed and decrease the likelihood of falling off, like you said, picking one thing, staying consistent in it despite whatever external factors, right? So if you feel like, okay, I can't be consistent with a healthy diet, I can walk 10 minutes a day out of a 24-hour period. I can walk 10 minutes a day. And then increasing, as long as we maintain that consistency, increasing the frequency, the duration, and then adding more things. It doesn't have to be a drastic change all at once, but eventually, when you look back, you'll see what kind of drastic change that you've made and how that has impacted your life and endometriosis symptoms. But again, I'm with you on at least, I was gonna say 12 weeks. Give it time, give it sufficient time.
Awesome. Thank you so much for that. So hopefully you know the answer to this already. Will these changes be the cure? The answer is no. They will not be the cure. We currently do not have a cure for endometriosis. I don't believe in giving false hope when it comes to a cure with this. I'm hoping that as the decades go on, that we're able to actually change the answer in response to this. But right now, we don't have a cure. But the purpose of these things is to make sure that you're able to better manage and that you're able to have a better quality of life. Because if you're able to get outside and play with your kids compared to being inside stuck on a couch because you're in so much pain, or maybe you're able to actually get out for that date and now you're able to once again engage in social activities, your depression, anxiety, those different things begin to improve. So these are to help try to manage and mitigate some of those symptoms. And there's one thing in addition to this that I want to speak on is, will this be the cure to infertility? No. However, the reason why I bring up infertility is because it is very common for individuals with endometriosis to also be at higher risk for infertility because of the irregular cycle, because of the adhesions, because of those various hormonal changes as well. But no, this would not be the cure for infertility. But every single change, lifestyle modification that we gave you, every single fertility specialist is going to tell you to implement those as well. So this is going to be important if fertility is a goal for you. So that way you will already be one step ahead. So when you go to see the reproductive specialist, the endocrinologist, that way they're able to help you say, hey, you know what? Oh yeah, you're already working out. You're already getting enough sleep. Your nutrition looks great. You're minimizing toxins and environment exposures. You've already checked off almost every single box that they have to educate patients on when it comes to fertility. If you can check off those boxes, now they can begin to further investigate, is this a hormonal issue? Is this a structural issue? What can we do to better benefit this individual in front of us? And Dr. Williams, I would love to hear your thoughts on, like I said, especially with this being a cure for endometriosis and cure for fertility. We know it is not, but we know that these things are important with managing both of those.
Right, because 100% when patients are coming in with those symptoms or infertility or concerns for infertility, and so, like you said, if these changes may not be a cure, however, if they can help mitigate your symptoms so that you can do the things that you desire to do, they are way more than worth trying in order to get that transformation, in order to take you away from having to take time off of work or for your business. Yeah, maybe we don't care too much about being employed by someone else. I'm just kidding. I'm just kidding. Like, let me take that day off. I'm just kidding. But like, again, like whatever career aspirations that you have, or time with your family, or time for yourself, even just spending the day having a period where you don't have to be in bed all day, right? So if these changes can impact your symptoms in a positive way, then they are worth doing, even if they're not in a quote unquote cure.
Perfect. Awesome. So additional treatment options. I'm a physical therapist. I treat a lot of things when it comes to pelvic health related topics, including endometriosis. And I tell my patients, let's see what we can do to try to help with your symptoms. So all of these different things that we've already discussed, something that I bring to the table when I'm speaking with my patients. There's one thing that we did mention in the beginning when it came to a common symptom, and that's pain with intercourse. So I do want to at least introduce this device here. So there is a device, ladies, if you do not know, it is designed to help with tolerating the depth of penetration because it is called a penetration buffer. This particular one is called O-Nut. And if you are interested in O-Nut, please contact me because I can make sure that you get a discount code before purchasing this. But it is a silicone-based device, so it does stretch, as you can see. Reason why that's important is because this is going to go around the penetrating object, penis, sex toy, whatever it may be, dilator as well. And with it going around there, you can actually add one, or you can stack them all together. So now you're able to control the depth of penetration itself. So now with penetration, we're only going to actually feel this much versus having the entire thing, okay? And with this itself, there are 4 different ones. So it's 4 different layers that you can kind of stack on top of one another. A lot of people report it helps. So if intercourse is a goal for you, this is something that, yes, this can help. Another thing that can help in addition to being able to tolerate the depth of penetration is chronic pain. We hold in a lot of our muscles, especially those pelvic floor muscles. So seeing a pelvic floor physical therapist, we can help you decrease the pain by teaching those muscles to relax and also making sure they still are strong enough. Most of the time, most people are overactive, meaning the muscles are doing too much of the day as well. So we're working on trying to get the muscles to relax. We're working on trying to decrease any type of trigger points. We're also able to do different things such as dry needling, and then using a TENS unit in various ways. So there's certain people where I'll use a TENS unit on the lower leg to try to help with bladder symptoms. Other times we'll use a TENS unit on the lower back around this pelvic sacral region to try to help with pain as well. So there are different things that we can do in addition to what most people are becoming familiar with pelvic floor therapy. They're like, oh, all you do is Kegels. No, so much more than that. If you need help with that, yes, I can help you with that. But it's so much more that actually goes into it, because we want to teach your parasympathetic system to be able to kick in, so that way you have a better balance between the sympathetic and parasympathetic, that fight or flight versus the rest and digest. So that way now you're able to get through the day, you're able to have different tips and techniques, so that way you're better able to manage those symptoms. We also work with different things when it comes time for, in addition to the bladder, also with the bowels. A lot of women end up constipated. So we can teach you different techniques to try to help decrease the constipation. We can even have the whole magnesium talk, because a lot of people just aren't getting enough in their diet. So offering different suggestions food-wise that you should consider, and even letting you know, hey, maybe you want to talk with your provider about taking a magnesium supplement as well, just to try to help. So like I said, I'm a pelvic physical therapist, so that is what I'm passionate about, making sure people have the correct tools. But I also want to make sure that you recognize who I refer to. With me seeing people who are dealing with chronic pain, there is a component that comes with mental health, because it does impact you long term. So I frequently refer people to mental health counseling, so that way they can get the treatment that they need, because we're not just treating the physical symptoms. Now we're treating the symptoms that go along with that. So psychological and mental symptoms, cognitive symptoms as well, because your body has started to perceive pretty much everything as a threat. And we need for your body to recognize that not everything is a threat, and it is okay for it to be able to relax. So yes, you're addressing a form of trauma, and it is important that we have the correct individuals there for you to be able to address that. With acupuncture, acupuncture is becoming very popular in the US. It is based upon Chinese medicine, so based upon the meridian principles, but it has been shown to help with chronic pain. And one question I always get with people is the differences between acupuncture and dry needling, because as a physical therapist, I do dry needling, I don't do acupuncture. So when it comes to dry needling, I'm needling directly into the muscles, sometimes a little bit down to the bone, depending on what we're doing. Typically, with endometriosis, we're needling into the muscles to try to help the muscles relax and help decrease spasms or trigger points. And also with physical therapy, dry needling, we're more so doing it with like a perineural stimulation, so along the nerves itself, so that way we can try to indirectly stimulate the nerves to try to offer relief of symptoms elsewhere. But acupuncture, like I said, is based upon the meridian principles. So there are different locations in the body that correlate with the visceral region, which is the abdominal region, pretty much, where you can add a needle in there, a very superficial needle, so just to the top layers of the skin, to try to help manage and decrease pain. So some people really do benefit from acupuncture. And if you're someone who's already taking a lot of medications, there's no harm in giving this a try, so that way you can see, hey, will this help me manage my symptoms? Is this something I need to routinely incorporate as well? And you've already heard me talk about the importance of diet. So yes, you're going to see this again, because diet can be key with managing symptoms. Diet can be key with helping to decrease the reoccurrence of symptoms, as well as far as how rapidly they reoccur. Because studies have shown that individuals who have a more balanced diet, typically a diet that is more plant-based or even the Mediterranean, that they have a less occurrence of the symptoms as far as how rapidly they prevail. And Dr. Williams, are you aware of additional treatment options for individuals with endometriosis that you believe would be beneficial?
Yes, so like you said, acupuncture is it is definitely worth trying. And of course, as a medical provider, recommending medications if a patient needs it, like birth control, or referring them to an OBGYN for procedure or surgery. But based on what we've talked, again, speak with your doctor separately, but these are a lot of changes that people can make even just now before starting medications. Again, that should be the first prescription, are addressing the sleep, diet, exercise, weight management, and then having acupuncture, mental health, counseling, pelvic PT, all the things before always going to medications or surgery.
Perfect. Awesome. Well, thank you so much. So the last thing, yes, I'm going to read this verbatim, because you are your best advocate. Many people do not speak up or express concern with a healthcare provider because they feel as if they do not know enough. You know what you are feeling and how it is impacting your life. Speak up and ask your and as your healthcare provider, ask questions. They are there to help educate and provide care. So I actually told a patient today, and I say it all the time. We may be the experts on the human body, but you're the expert on your body. So please make sure that you are letting us know how you feel. So yes, you may not know how to articulate everything well. Do the best that you can. Yes, things may not make sense, but you know what is your normal, and you also know what is abnormal for you. I can only tell you this is what we say is normal, and as far as healthcare and medical field go, this is what science says is normal, but you also can communicate that better just based upon how it is impacting your life. So you are your best advocate, and it is time that we speak up. It is time that people actually hear our voices and hear our questions. So do not let a provider rush you out the room. I understand the healthcare system that we're in, but like I said, they're primary care physicians because they're typically the ones who will see these individuals first, who practice in a model such as Dr. Williams, where they're able to sit down and spend that time with people. So find a provider who's able to actually get your thorough history so that way you can receive the best care long term. So thank you all so much for joining us.